Bismillahirrahmanirrahim. Uh, this video covers about the historical aspects of the acute inflammation, and the references about this video are these. Inflammation is a term that is derived from Latin word inflammare, which means to set on fire. The body or tissue is set on fire in this pathologic process, and this pathologic process was a very long time ago. This was introduced by Galen, who was a Greek physician. He termed this condition as phlogosis and defined that this is a protective response of the body that eliminates infections, necrotic tissue, and foreign particles while activating immune system of the body. So we can define now inflammation as a systemic and local reaction of tissues and microcirculation to pathologic insult. It is a response of vascularized tissue to infections and damaged tissue that brings cell and molecule of the host defense from the circulation to the site where they are needed in order to eliminate the offending agent. So, a response of the vascularized tissue that is set into the motion for the elimination of the offending agent by orchestration of various host defenses, molecules, and cells. These can be phagocytic leukocytes, antibodies, complement proteins, natural killer cell, dendritic cell, or even epithelial cells of the body. Then there is one clarification that this term inflammation is usually confused with infection by undergraduate students. Inflammation is a protective response of the body that is triggered by various agents. These agents can be infectious or these can be non-infectious, while the infection is caused by microbial invasion or toxin production. Now we will review the historical aspect, some of the historical aspect of this entity, the inflammation. This condition was known since 3000 BC when ancient Egyptian physicians they described this as tissue swelling and redness that occurs in response to injury. In 5th century BC, Hippocrates proposed the humoral theory in which he proposed that the disease process, whatever disease process occurs in body, is due to the disturbance among the four fluids that are present in the body: white, yellow, red, and black piles. So it is not the injurious agent, but it is basically the imbalance that lead to disease or some process that occur within the body. Aulus Cornelius in 1st century AD, he has documented the four cardinal signs of the inflammation that are rubor, calor, dolor, and tumor. Rubor stands for redness, calor for heat, tumor for swelling, and dolor for pain. In 2nd century, Claudius Galen, he expanded the Hippocrates teaching and he emphasized and reinforced that inflammation is a disease and wound healing, and he was the one who coined the term phlogosis. Avicenna or Ibn Sina in 11th and 10th century, he described inflammation in detail in his book The Canon of Medicine and linked this inflammation with the systemic disease process that is the basis of today's understanding of the inflammation. John Hunter in 18th century, he recognized that inflammation itself is not a disease, but it plays a vital role in the injury or after the injury to the body. Then there was some rapid advancement in 19th century in the field of inflammation. Earlier, Sir Rudolf Virchow, who is the father of modern pathology, he coined the term functionalasia. He stated that due to the four cardinal signs, the Ruber, Keller, Dollar, and tumor, there is loss of function to that particular body part. So, loss of function or functionalasia is the fifth cardinal sign of the inflammation, and he also termed or he also stated that this inflammation is a cellular response to injury. Later, Julius Kenham, he stated or he discovered the involvement of leukocyte migration from the blood vessel into the tissue, and he linked the inflammation with the immune response. In 1908, the Elie Metchnikoff, he got Nobel Prize for introducing the concept of phagocytosis, and he showed that WBCs engulf and they digest the pathogen during the process of inflammation. Later in 19th century, Paul Ehrlich, he discovered mast cells and also their role in inflammation, further understanding the immune system activation during the inflammatory process. Thomas Lewis in 20th century, early 20th century, he identified histamine and some other chemical mediators of inflammation by his experiment in 1929 that we are going to study later. And as you know that today's pathology basically lies in molecular and genetic studies. So we are in 20th and 21st century. We are looking for almost everything. We are looking for molecular and genetic basis of the process. So it's true for the inflammation. In his classic play, Sir George Bernard Shaw, he stated that there is at bottom only one genuinely scientific treatment for all disease, and that is to stimulate the phagocyte. So this statement reflects the early 20th century medical understanding of the immune system, particularly the role of phagocyte and cells that engulf and digest the pathogens. And these phagocytes, by digesting these pathogens, play a central role in combating the disease. So, Bernard Shaw's inclusion of this perspective in his play serves as a satirical commentary on medical practices of his time, highlighting both the advancement and limitation in the field. So the five cardinal signs of the inflammation, in which the four were defined by Celsus and fifth one added by Virchow, the five cardinal signs of inflammation are rubor or redness, that is the result of vasodilation, calor or increased temperature or heat, that is due to increased blood flow that occurs due to vasodilation. Then there is disturbance in the vascular permeability that results in edema that is evident by swelling or tumor formation, and there is release of some chemicals at the site of this injury, and this is initially it is bradykinin that is responsible for dolor or pain, the fourth cardinal sign. Finally, due to swelling and pain, there is loss of function. The patient avoids to move that area, or there is some loss of function due to some chemical process that is going on in this particular area. So 5 cardinal signs of the inflammation are rubor, Keller, dollar, tumor, and functiolasia. Then there are 2 phases. So be particular about the answer to the examiner about what is asked. Usually, people answer cardinal signs in response to phases. The phases are different. There is early inflammatory response that is for the elimination of injurious agent, and then after the elimination of the agent or during the eliminatory process, the body attempts to heal. That is the healing phase. And in healing phase, tissue repair. Sometimes there is also harm or danger in the second phase that occurs in anaphylaxis or after the development of adhesions as a response to reparative process. Earlier in this lecture, we discussed about Lewis experiment. Lewis experiment described the triple response in his experiment, and he demonstrated hemodynamic changes that occur during inflammation. He explained the classical signs of the inflammation: redness, heat, swelling, and pain. And in this experiment, he involved firm stroking of the skin with a blunt point to elicit vascular response. There is development of a red line that appear within second as the red streak at the site of stroking, and it is the result of local vasodilation. Then there is flare, that is bright reddish area that surrounds the red line, and it is due to vasodilation. Then the third one is wheal, that is formation of swelling or edema in the surrounding skin. So redness, flare, and wheal are the triple response of the body that occurred in the Lewis experiment. Thank you for watching this video. You can use the comment box for any question if you have.